If you had 30 seconds with our health ministers, what would you say to them on this issue? I would think it would be something along the line, good night's rest is absolutely vital to good health, and many of us are not getting it, and we better figure out why.
We're not, I mean, wouldn't it be easier to treat the sleep apnea instead of treating the diabetes and the heart disease and the strokes and the dementia and the Alzheimer's and the kidney disease and the impotence and all those other things? Wouldn't it be easier to make an appliance? I mean, that's $2,500. I mean, that's, and different dentists charge different amounts, but that's custom made for their mouth, not like you get on the internet. This is custom made for their mouth. And then we also make sure it works because we give them a sleep study. We have to give them a sleep study to make sure it's working because we want to stop, a dentist want to stop the snoring and the apnea because the apnea kills.
And people assume, well, do I have to go to the hospital and get hooked up with all these wires? There is another option.
Well, I have home sleep studies I give them because some pay, but the best diagnosis is actually go to the hospital and get all hooked up with the wires. But I have home sleep studies I give patients to make sure it's working. But the initial diagnosis is usually done at the hospital if the patient will go. Some patients say, I'm not going to go there. I heard they put all these electrodes all in my face and I don't want to go through that, so I don't want that. So I said, we have a home sleep study, which is a lot nicer for you. You sleep in your own bed and we can get a preliminary diagnosis. And then we can decide where we're going to go from there. That diagnosis, though, has to be read by a medical specialist.
It strikes me that there's such an irony here, that this is one of the most compelling and threatening health issues we have in this country,
Yeah,
but the awareness of it is incredibly low.
it is. It is. I think if you drove your car into a tree, fell asleep at the wheel, your physician would for sure send you for a sleep study. But if you're just tired and you're snoring, they don't ask those questions, I don't think. That's not on the medical questionnaire. And it all goes back to education. But things are getting better, but it's slow, Andy. It's slow. It's slow.
Well, you've been a regular guest on our talk show. I'll continue to have you on because we desperately need to know this stuff.
Yeah, we do. We do. The studies show that if you have severe sleep apnea, you're going to live 15 years less because you're going to get all these debilitating diseases. You're going to get diabetes, you're going to have a stroke, a heart attack, congestive heart failure, atrial fibrillation. You're going to get all these things which will shorten your lifespan. So you need oxygen. It's a new drug, Andy. It's a new drug. Everybody needs oxygen. You said it, I said it, that's what you need. And the oral appliance will give you oxygen, and the CPAP will give you oxygen. You've just got to get oxygen. If your airway is blocked, your tongue's falling back, that's what you need.
You're drowning and you don't know it.
Yeah. You're dying, you don't know it.
You're dying and you don't know
You're
it.
dying, you don't know. You're slowly, your health is going down the tubes. Not good.
Thanks for the education. We'll talk again.
Thanks, Andy. Thanks for coming.